Yeah, and then just adjust it up. Now tilt the camera up.
Or down.
So you can see our.
Oh,
Can I do it?
We can mute ourselves.
Wait, but he's like, okay.
It's fine.
All right, we are live. So I'll give people a few minutes to join.
You have to have this grace. But you're over it all.
Yeah, or yeah. No.
This is good. We're all in it. So that is good. Yeah, they're in it. Wait, can we see ourselves? And then push it.
Just move the arm, move the arm down. That'll go there.
Here we go. That's good. Okay.
You pinned us, didn't you?
Oh, good.
Go to the slide.
Can you do the yeah, that one.
I was just doing it like in case you have something. Not muted. That's good.
Hi, everyone. We'll get started in 1 minute. All right, welcome everyone. Welcome to this important critical conversation titled Intimate Partner Violence in the LGBTQ plus community in North Carolina. And so first I want to just talk a little bit about WomenNC and what our work does. So our mission is to empower the next generation to advance gender equality in North Carolina. And our vision is to create a world free of gender discrimination. WomenNC has been committed to researching and finding public policy solutions to issues around gender disparities since 2009. We are a 14-year-old organization that trains college and university students to rigorously investigate instances of gender disparity and inequality in North Carolina communities. After researching issues, students then recommend public policy solutions that include advocacy strategies to improve the status quo. WomenNC works with faculty and undergraduate students at UNC Chapel Hill's Public Policy Capstone course to provide a bridge between academic policy analysis and real-world workplace policy analysis. So small teams of students work with WomenNC to provide actionable public policy research that focuses on gender issues of concern in North Carolina. Meeting with WomenNC staff, aka me, student teams develop a work plan, research relevant policy issues, collect relevant data, identify and analyze policy options, and produce reports that include specific recommendations for action. In these projects, students develop skills in teamwork, leadership, communication, professional etiquette, and time management. The capstone students' research will add to our organization's knowledge about this macro level issue impacting the organization, and future WomenNC scholars and more broadly gender researchers to investigate these concerns in specific North Carolina communities in the future. This project is an initial step towards gender equity that other researchers can build on. So now I would like to introduce you to our student team. Ben Tran is a current senior at UNC Chapel Hill studying economics, public policy, and business administration. As a gay first-generation immigrant and person of color, he grew up witnessing himself and others with similar backgrounds experience a lack of support. From there, he became curious about learning how to advocate for himself and others around him who share these experiences, hoping to bring about constructive change and cultivate inclusivity and equity. Inside the classroom, he has focused on LGBTQ plus health and health policy through his coursework. Outside the classroom, he has worked with new student and family programs as an orientation leader and with the University Office for Diversity and Inclusion as a DEI fellow. Next, we have Sydney Shapiro. She's a senior at UNC Chapel Hill studying chemistry, biology, and public policy. From previous coursework, she has researched an exclusive nature of the UNC sexual assault policy and opportunities for improvement from discussions for those most affected. She is excited to center trans and lesbian women's experiences in the community-based policy to promote WomenNC's mission of gender equality. Next, we have Adele Reynolds. She is a senior at UNC Chapel Hill studying public policy and history. She is particularly passionate about the intersection of gender and sexuality with social justice and how that informs policy and advocacy. Through prior coursework, she has done research on LGBTQ+ adoption policy, inclusion of social justice pedagogy in public schools, and gender-based inequality in the job market. Adele is interested in centering community-driven work and is excited to be working with WomenNC to address gender and sexuality-based violence in North Carolina. Ethan Sichel is a senior public policy and drama major at UNC. Some topics he has researched include LGBTQ+ curriculum in schools and how social safety net policies like earned income tax credit affect health outcomes for LGBTQ+ people. He is excited to continue research, supporting and advocating for LGBTQ+ communities. Outside his academic activities, Ethan is heavily involved in student theater and dance at UNC. He is looking forward to continuing his research interests with the guidance of WomenNC. Next, we have Abby Winterich-Knox. She is a senior studying public policy. She is most interested in policy reform that is based on people's actual lived experiences. Growing up in North Carolina as a gay woman has informed her areas of research. She has focused specifically on LGBTQ+ discrimination in schools and anti-LGBTQ+ legislation. Abby feels that it is critical to learn specifically about gender-based violence in North Carolina, and she is looking forward to broadening her knowledge while supporting WomenNC's mission in a meaningful way. Next, we have Grace Lena, who is a junior at UNC Chapel Hill studying public policy and political science. She is interested in researching gender-based violence to inform policy on gender equity in North Carolina with ties to both social and economic implications. She is excited to be working with WomenNC to gain experience and further the available research on gender equity and inclusivity. So these are such amazing group of people who I've been working with this past semester, and they're going to tell you a little bit about their project and their research that they've been doing this semester.
Hi all, thank you so much for joining us today, and thank you Ava for that really lovely introduction. Today, as Ava introduced, we'll be discussing our UNC Public Policy Capstone Research Project, which is on intimate partner violence in the LGBTQ+ community in North Carolina. For the purpose of this presentation, we'll be defining LGBTQ+ as lesbian, gay, bisexual, transgender, queer, or questioning, and that's how we'll be referring to that community throughout this presentation. Additionally, as seen in our title, we are discussing some distressing topics such as intimate partner violence, domestic violence, gun violence, homicide, and sexual assault. So just keep that in mind as we go through this presentation. Thank you all again for joining us today. Okay, so our agenda for our presentation today is we're going to take you through the purpose of our project and research, some background on our topic, which is intimate partner violence, or IPV for short, in North Carolina, our research methodology, some key findings that we found, our policy recommendations, and next steps that both WomenNC and you as the viewer can take on this issue. So starting our presentation off with our project scope, we started with a really broad research question, which of gender-based violence in North Carolina, gender-based violence being violence committed against someone based off of their gender identity. And then after conducting some preliminary research, we narrowed that scope down to intimate partner violence, or IPV, in North Carolina. And then from there, to present and compile our research, we conducted a literature review that reviewed current literature on intimate partner violence and violence against LGBTQ plus folks in the US and in North Carolina. Additionally, a team interviewed field experts. They interviewed 5 experts that have relevant experience to gender-based violence in North Carolina. And then using the literature review and the information that we gained from interviewing experts, we made and created a survey whose goal is to provide a base for more data collection in the future.
So to begin our project, we first had to assess the goals that we had going into it. And to do this, we looked at the current state of LGBTQ plus protections in North Carolina, as well as the prevalence of violence in North Carolina, separated both between Western, Eastern, and Central North Carolina. And we did this to gain an understanding of the connections between acts of violence, such as identity abuse, which is the weaponization of systemic oppression against those within the LGBTQ plus community. And that can include outing someone or threatening to out them, or any sort of violence that is connected to your gender identity or your sexual preferences. And we wanted to see how this would affect the LGBTQ plus community, specifically in North Carolina, based on existing literature. And then we wanted to identify the gaps that we could fill to get resources and provide tangible policy recommendations for WomenNC to advocate in the future. So to begin, we're just going to define IPV, or as we said, intimate partner violence, and that refers to aggression from either a current or a former partner that includes physical, psychological, or sexual violence and stalking. In the United States, over 41% of women and 26% of men report IPV experiences in the United States, regardless of their sexual orientation. But we have found that IPV affects lesbian women and transgender women more severely. And this topic is also one of the most severely understudied aspects of intimate partner violence. Because we found this large gap in research, we wanted to be able to address the violence that we see within the United States and provide resources to those experiencing intimate partner violence.
Okay, great. So going into the methodology a little bit and how we gained enough research and information to create our final portfolio and the what we're presenting today. As Adele mentioned, we had kind of a large overall task of researching gender-based violence, which again is violence based on gender identity, but that can extend to violence on the basis of sexuality as well, against lesbian and trans women in North Carolina. So we knew that from what Ava and WomenNC had shared with us, that there was a lack of research for this specific type of gender-based violence in the US, and including in North Carolina. So we thought that it would be important to not only find current literature and research on the topic, but also interview and speak to experts. So that led to us splitting our team into kind of 2 sections. One was focusing on research and literature and kind of the databases, and the other one was focusing on identifying, interviewing, and compiling qualitative data from experts. So from the beginning, we knew that we wanted to create a survey that WomenNC could distribute, not only in order to gain more data that is a better reflection of the current state of violence against lesbian and trans women in North Carolina, but also to connect those individuals to resources. So with this in mind, we searched databases using terms such as LGBTQ+, intimate partner violence, North Carolina, domestic violence, in order to find relevant research to create our literature review. And then the other members of our team were interviewing the individuals, which Ben will talk about in a minute, that have relative expertise to our topic. We used both of these findings primarily from the interview to create a survey that WomenNC is going to distribute to individuals around North Carolina. Awesome. So going into our findings a little bit, I'm going to briefly cover our literature review findings, and then Ben will talk about our findings from our interviews. So we found a few kind of key things of how gender-based violence uniquely affects LGBTQ+ women in the United States. First, LGBTQ+ women are just uniquely and like very specifically affected by gender-based violence in a way that they're cisgender heterosexual. One, they're just more likely to experience intimate partner violence and domestic violence. Quickly, I know Grace defines intimate partner violence, and while domestic violence is often used interchangeably with IPV, in this case, we're needed to refer to not only violence between former or current romantic partners, but also violence between roommates, family members, parent, child, etc. So again, there just is a pretty big gap in literature and really quantitative data on the experiences and the rates of IPV and domestic violence experiences in the US. But we did find that between 25% to 40.4% of lesbian women experience IPV in the US and 31.1% to 50% of transgender people experience IPV in the US. The reason that the kind of like language that we use is important here is because when asked, and Cindy will get into this in the survey, but when asked if somebody has experienced intimate partner violence, often the rates come back much lower than when asked for very specific behavioral experiences. So you could see that when asked for specific behaviors of experiencing rape, physical violence, or stalking, that came back with 43.8% of lesbian women having reported this and 61.1% of bisexual women reporting this. Our second primary finding from the literature review is that there's a disproportionate amount of gun violence used against LGBTQ+ women in the United States. While slightly over half of all homicide cases in the US committed against women are committed using a firearm, there's a significant increase when looking at homicides with transgender individuals as the victims, with 72% of homicides against transgender people are committed using a gun. Legislation restricting firearm possession, we found leads to less homicides across the board, like across all cases of homicides, which includes LGBTQ+ populations across the US. We specifically found that states that have 40 or more gun control provisions had 56% fewer instances of female intimate partner violence and 58% lower rates of suicide, homicide, intimate partner crime than states that had fewer than 40 provisions. So our key findings from our literature review confirmed the unique ways that trans and lesbian women experience intimate partner violence and informed the policy recommendations that we provide later.
And as previously mentioned, coupled with our literature review, we interviewed subject matter experts with relevant expertise and experience in LGBTQ+ studies and LGBTQ research. So to go more further in depth, all of these interviewers brought specific insight that we were able to use to tailor to with our further developments in our project, such as our policy recommendations and next steps in addressing this issue. So for first off, we were able to interview Dr. Rebecca Kreitzer, who is Associate Professor at UNC Public Policy. So within this interview, we were able to gain insight on regulations and policy regulations within North Carolina. In addition, we interviewed Dr. Beth Morocco, Associate Professor and Associate Director at UNC Healing School of Public Health. So with Dr. Morocco, we were able to gain insight on how to conduct a survey, create a survey, and figure out the workings behind surveying specific demographics such as the LGBTQ+ community. And in addition, we also interviewed Nyla, who was also a WomenNC scholar and who also did a presentation for WomenNC involving transgender healthcare within UNC school systems. And with that, we were able to gain a lot of insight on workings behind transgender people and how that is coupled with their experiences within healthcare. And furthermore, we were able to interview Mary Beth Beckner-Lau, she is a domestic violence community educator for Women's Advocate. So with the conversation with Mary Beth, we were able to gain insight on domestic violence centers and domestic violence shelters, as well as homeless shelters, to get those perspectives as well too in the work behind shelters and creating to support individuals. And lastly, we were able to interview Kylan. And with that interview, we were able to gain insight on crisis advocacy and rape crisis centers for LGBTQ plus community members as well. And with the variety of expertise across all of these subject matter experts, we're able to tailor these interview questions to their specific expertise to gain further insight. And so with all of these interviews, the main key takeaway that we learned and found within these interviews and conversations was explained within this quote by Mary Beth. And in essence, we recognize the issue that a lot of people within the LGBTQ plus community, especially lesbian people and transgender people, weren't aware of these occurrences happening within them and to them within these partners and relationships as well too. So some key takeaways that we found that we then used to implement and create our policy recommendations and next steps for our project was that LGBTQ plus women were not as likely to interact with institutions when facing gender-based violence. And these institutions involve resource centers, shelters, as well as healthcare systems as well too. And we also found that there was an increase in potential risk of institutional harm. And with this involved potential transphobia and homophobia that these LGBTQ members would experience when seeking help and professional help for these violent acts. In addition, we found that the disclosure of sexual orientation or gender identity within shelters prohibited a lot of LGBTQ plus members from finding asylum within these shelters and prohibit them from having that providing them that safety that these shelters should be providing them. And we also found some more insight on crises help and crises advocacy with our conversation with Mary Beth, which involves Minnesota's Day One Crisis Line, which streamlines state resources and accessibility within Minnesota for LGBTQ plus resources. And with these crises lines, this mitigates the whole hassle of finding professional help and seeking institutional help for LGBTQ plus members. And these crises lines combine all of the phone calls that they have to make from 8 to 5 calls to 1 in order to make the process easier for them to obtain resources and proper care for these for their experiences.
So as Abby and Ben talked about from our literature review and our interviews, we came up with really 3 main takeaways that were important for us to center in our next steps. So the first one is the need to support and fund the gathering of comprehensive and specific data on violence against the LGBTQ plus community in North Carolina and the United States. Here in the literature review, our team, we had a really hard time finding accessible North Carolina specific material on intimate partner violence for LGBTQ plus individuals. And going off of that, in our interviews as well, speaking with a lot of the experts at the crisis centers and shelters, it is really hard to make the case for resources and ask for resources if there isn't data to back up people's lived experiences and what they know is true. So that is very important. Another important next step is to intentionally focus on the violence experienced by LGBTQ plus women and LGBTQ plus women of color. This issue is really intersectional, dealing with race, gender identity, sexual orientation, and all of those things build on the difficulty to seek help and seek care. And in addition to that, intimate partner violence is a very heterosexual, straight-coded kind of phenomena. And so it can be difficult to get out of that mindset and recognize that what is happening is intimate partner violence. And lastly, going off of the data and intentionally focusing on experiences, it is really important to fund resources to LGBTQ plus informed intimate partner and domestic violence centers to make them more accessible and accepting, and really just to make it easier for those individuals to seek help. So as mentioned previously, using our findings in our literature review and our interview, we created a behaviorally specific survey in order to address some of the gaps in information. So behaviorally specific is something that came up a lot in our interviews and whatnot, and that is really the focus on that definitions matter and how people define things may differ from person to person. So giving specific examples is really important. For example, instead of saying, has somebody hurt you, we would ask, has somebody slapped you or kicked you? Getting really specific so people can recognize what's happening to them. In addition, as I said earlier, this intimate partner violence is really a heterosexual and straight coded kind of a phenomena. And so asking behaviorally specific questions may get at certain activities that people would otherwise not recognize as intimate partner violence. So with that in mind, the survey collects data on demographics, stalking and violence online, physical violence, identity abuse, and financial and psychological violence, and care-seeking behavior. The main two that I want to highlight is first identity abuse. Grace talked about this earlier, where identity abuse is essentially a fear of, a tangible example is somebody outing you to people you don't want to be outed to, and things of that nature. And that is something that is really not experienced by the heterosexual community, and it's not highlighted in a lot of intimate partner violence surveys. However, it is an experience of LGBTQ plus individuals, and that is really important to identify. Another important aspect of the survey is that it gets into care-seeking behavior. Something we really found in our interviews is that at every step, there is a fear that the person on the other line of the phone is not going to accept your identity, your sexual orientation, is going to question you. And that really deters a lot of LGBTQ plus individuals from seeking care. So these questions aim to kind of pinpoint where the main issues in North Carolina lie.
All right, so obviously we've learned a lot of information from both our literature review and our interviews. And so there's a lot of different ways that we could have tailored the policy recommendations. But something we wanted to keep in mind was that these recommendations should be specific and tangible enough that organizations like WomenNC can actually advocate for them on a state level. And so this is how we came up with some of our policy recommendations. So our first policy recommendation is to advocate for a red flag law in North Carolina. Essentially, a red flag law will let anyone be able to go to the court and to take away someone else's possession of their firearm if they can prove that they are a threat to others or themselves. As mentioned in the literature review findings, there is a almost direct cause and effect with more gun provisions in the state level and a lowering rate of IPV. And so we thought that this is a really important step in order to lower IPV rates across for everyone, including the LGBTQ plus community. However, we do recognize that, especially in North Carolina, this is a very controversial policy recommendation and perhaps is not the most politically feasible, just given our current state legislature. And so a shorter term version of this is to actually advocate for a stronger enforcement of a current law that we have. So in 2003, North Carolina passed a law basically saying that anyone that has a domestic violence protection order against them is supposed to give up their possession of a firearm. But studies have shown that this is not a very effective law as it stands right now. There's a lot of loopholes. Courts are supposed to ask for proof that firearms are not in possession of these perpetrators, and that is not always the case, as well as these perpetrators are supposed to give up their firearms to sheriff's offices, and that is also not the case. So a shorter term version of this policy recommendation would be to advocate to enforce the law that we currently have in a more stronger manner. Our second policy recommendation is to prioritize LGBTQ plus women in government-funded domestic violence shelters. So as we talked about, a lot of people, especially LGBTQ plus women, are really scared to seek these institutional help for fear of being turned away based on their identity. And so we feel it is important to have the state essentially prioritize these more vulnerable communities and to have resources for these domestic violence shelters in order to help them with their unique and nuanced situations. We also felt like this was a more actionable recommendation. This is really a regulatory matter, so this would be something that we could advocate to Governor Cooper and would be able to help prioritize and help LGBTQ+ women in North Carolina. And then our last policy recommendation comes from our interview with Mary Beth that we had talked about, and that is to create a statewide network and a hotline. This would be overseen by the government, and this would allow for coordination between multiple domestic violence shelters across the state. So as we learned in our interviews, on average, people call about 8 to 15 different times to find the appropriate resource or shelter for them. And when we're in these very like high stakes situations, making that many calls can deter people and can just be a burden to people that are seeking help. And so having some kind of network where people can call just one number and then being able to coordinate that would be really helpful in helping to decrease these IPV rates. We also suggest that this hotline would be set up in the Office of Violence Protection, which is a new office that Governor Cooper just recently created through his executive powers. So yeah, we to advocate that. Next slide. Cool, so we have a few call to action things that you all as the viewers can do right now to help combat this issue. One is that we suggest contacting the Office of the Governor in North Carolina. This is because Governor Cooper has a lot of like regulatory power that we talked about. So whether that's prioritizing like funding or resources, and also this Office of Violence Protection that we talked about is currently being set up right now. So this is a great time to call them and to make sure that they are prioritizing these more vulnerable populations, such as LGBTQ+ women. We also suggest finding out who your local state legislators are and contacting them, whether it's to make sure that we are protecting LGBTQ+ women in terms of violence. Also currently right now in North Carolina, there's a lot of bills that are targeting the transgender community. And so while that's a little bit more tangential to our research, it is really important to advocate for all issues that are affecting this community of LGBTQ+ people.
So finally, we've compiled a list of resources for people in need. And we definitely think that it's good to have these resources on hand, even if you do not think that you're the right audience for them. And we've separated it into Western North Carolina, Eastern and Central North Carolina resources that will connect you to crisis centers or hotlines. And we've made sure that these resources are accessible for all LGBTQ+ members and allies.
Okay, so we wanted to say thank you all so much for viewing our Facebook Live of our UNC Capstone Research Project. At this time, we wanted to just give a few acknowledgements. We want to extend thanks to WomenNC and specifically Ava Smith for the opportunity to work on this project and for their support and feedback and guidance throughout the semester. We wanted to say thank you to Dr. Crome-Lukens and all of our UNC Capstone advisors for their assistance and their encouragement. And then we wanted to extend a really special thank you to Lena for her kindness, her expertise, and her dedication to our team. I know I can speak for all of us when we say that we've really valued this experience and the knowledge and skills that we gained from it, we will definitely carry with us into our future careers. And so at this time, we would like to open the floor for any questions that any of the viewers have or WomenNC has, and we would really be happy to talk about our project and our research. Thank you all so much. Thank you.
Yes, that was an amazing presentation. Thank you all so much. So the first question we have is, this is open to anybody to answer. How do you think technology enabled intimate partner violence?
I can take that. Yeah, so actually when we were figuring out how to narrow down this research question, we were debating about looking into digital violence. We ended up not going that direction, but there is a ton of data and information about people being harassed on the internet, especially again, more vulnerable communities such as lesbian women, transgender women, etc. And so, yeah, that is a real issue. We just didn't have the scope or the time to look at it all. But yeah, that's like a really important and a newer type of domestic violence and intimate partner violence that we've been seeing.
Thank you. Yeah, I know that is a very big topic, especially the United Nations. This past CSW 67 posed that question and tried to tackle this issue about how technology enables violence against women and how it can also be used as a tool to eliminate violence against women. So yeah, that's a really interesting topic that, your research that you did can be expanded on in the future. Our next question is open to anyone. What are some of the difficulties you all experienced while researching intimate partner violence, and how did you overcome them?
That was
Well, we definitely experienced some difficulties, I think, especially in the literature review section. A big problem that we faced, to be more specific to North Carolina, was just a major gap in literature on intimate partner violence, specifically against the LGBTQ plus community, and then more specifically against lesbian and transgender women. And so I think that was a really big difficulty in research, was just there isn't a lot of research, and that is doing a disservice to this community. And then, as Sydney mentioned, it's really hard to advocate for policy recommendations and for solutions that could help ameliorate some of these issues that are reflective of the lived experiences of lesbian and transgender women in North Carolina, in the South, or in the greater United States, if you don't have that research, that academic research to back it up. And so that was definitely a struggle that I know the Lit Review team had, and was helpful in the interviews to kind of fill some of those gaps from experts, just things that we couldn't find in current peer-reviewed literature. That was a difficulty.
Yeah, definitely. And even at the United Nations, when they were trying to address this issue against violence against women, especially trans women, lesbian women, there's not that much research out there. So this is why this project is so important, as it is one of the stepping stones to getting started in that direction of more research and more data. And so then we can make more equitable policy solutions to combat these issues. Thank you. Exactly. So my first question is for Ben. How did you all reach out to the subject matter experts your teams interviewed?
So to reach out to as many subject matter experts and field experts as possible, we initially brainstormed as many people and as many individuals that we knew with relevant experience pertaining to the LGBTQ plus community, as well as gender-based violence. And with that, we were able to compile a list from our own personal and academic connections, but we were also able to contact stakeholders from provided to us and given to us by WomenNC and our initial interviewers as well too. So we were able to reach out to as many as possible, or as many as we could. And we knew that by reaching out to as many as we could, we would be able to have a specific or smaller amount of people that would be feasible to interview. So we ended up ultimately being able to interview 5 field experts, and we were able to have the opportunity to talk to all of those amazing women and gain insight on all of their experiences, their expertise.
Thank you, Ben. My next question goes to Adele. Were there any especially poignant pieces of information you learned from your literature review?
Yes, I think that a theme that appeared really often across multiple of our sources is exactly what I was discussing earlier, was just this gap in literature. And with that being said, the gap in literature, even with the gaps in literature, it highlighted that LGBTQ plus women are either comparably or more likely to experience intimate partner violence, but less likely to access care for that. And that was something that was evident across multiple points of research. And so I think that that is an especially like poignant piece of information that we gained from our literature review, was just that there's this gap between accessible resources and the truthful experiences. So there are a number of like CDC funded domestic violence centers and intimate partner violence centers that focus on violence prevention. But in that program, there wasn't anything specific towards LGBTQ plus people, which doesn't line up with the evidence that we learned that LGBTQ plus women are just as likely, if not more likely, to experience it. And so I think that that was a really important part of the literature review that we kept coming across, was just this gap between the experiences and the accessibility to tailored care.
Yeah, that is really important information. Thank you, Adele. So my next question goes out to Sydney. Could you speak a little bit more about what care-seeking questions entail in the survey?
Yeah, of course. So as Adele kind of just pointed out, there is kind of fear at each step of seeking care of, for example, big ones we found in the interview was in healthcare situations, will the doctor or physician be accepting or not of your identity, which can be really harmful with taking into question your experiences. Also with policing, we found in our interviews especially that North Carolina relies a lot on police to ameliorate intimate partner violence issues. And that is a great issue because the police force is a predominantly male profession, and there isn't a lot of intersectionality there that is accepting of others' experiences. Another main point is in domestic violence centers, even, especially with transgender individuals, there is a fear in centers targeted towards women. A lot of people don't recognize transgender women as women, and so that domestic violence center has to balance that with them as well. So there's just so many points where you can get discouraged when already reaching out is so hard and so inaccessible. So yeah, that's what the care-seeking questions try to get at and show in the data from the lived experiences that we learned about.
Right, exactly. And I know one of the people you interviewed, Nalia, she was a WomenNC scholar, and she did a little bit of her research on the state of trans-inclusive healthcare at the UNC system universities. And so her work was really important in this as well, as she made policy recommendations which help to remove policies and barriers that are detrimental to the physical and mental health of transgender and gender non-conforming students, as well as some other policy policy recommendations. So yes, that is very important and crucial, especially, if people are scared to seek out care, that is essential to their health. And so I have a couple more questions. The next one is to Grace. Did you notice any commonalities between areas with more severe IPV issues facing lesbian and transgender women in the laws in the area?
Yes, so when we originally were looking into firearm laws and hate crime protection laws for lesbian women and transgender women in North Carolina, we did find a good amount of literature that highlighted how places that had a history of hate crime or white supremacy, specifically during like the Jim Crow era, had been mimicked in present day, and these areas also suffered from a lack of hate crime legislation or protections for those within the LGBTQ plus community. And we also saw that law enforcement in these areas today would still be less likely to enforce hate crime legislation. So in areas where you do see more hate speech and violence against the lesbian women and transgender women in the United States, you also see less enforcement of laws, less arrests in these cases, which only increases the prevalence of IPV.
Right, exactly. Thank you. My next question goes to Abby. Who is left out of these conversations?
Yeah, so I think that it's super important to say that even within talking about the LGBTQ plus community, there is still a lot of discrimination and prioritization of individuals and demographics within LGBTQ plus people. So, for example, I think that there's two main kind of places that this should go next in research. One Sydney mentioned in the next steps, which is trans women of color. Black trans individuals face the highest level of gender-based homicide, like of any demographic. And again, Black trans individuals, the demographic, are also some of the least researched populations in the US. So outside of just North Carolina, but across the broader country, I think that it's like completely critical to study IPV among trans women of color and just trans individuals of color. Another thing that I mentioned pretty briefly, which I want to come back to, is the amount of violence that bisexual women face. That wasn't really our specific scope, but we did come across a couple statistics that show that bisexual women experience IPV at even higher rates than lesbian women in the US. And there is just like so little data on the amount of violence, sexuality-based violence, gender-based violence against bisexual women. But when over half, 61.1%, have experienced rape, physical or sexual assault or stalking of a demographic, which is the rate for bisexual women, I think that that is like as much of a kind of indicator that this is an area of study that we need to be focusing a lot more attention on. And a big part of the thing that we are hoping to help with the survey is to reach out to women that perhaps they're bi or perhaps they're lesbian or trans, whatever their background, and connect them with resources for specific care that they might not think is for them.
Yeah, that's a really great point to point out, especially with the prevalence of bi-erasure that people experience. So that's really interesting. My next question goes to Ethan. What are some challenges in this research process that you all had to overcome?
Yeah, I think Adele talked a little bit, obviously, just the data gap in general. It was challenging, especially for the literature review portion. But I would say, like, as a process in general, there are a lot of different moving parts, just from the beginning and organizing a work plan and figuring out what deliverables that we wanted to give and what would be helpful for WomenNC. And so there was a lot of coordination and project building and things going on top of all the research that we were conducting as well. But I'm gonna give ourselves a pat on the back. Everyone like put in such good work for this project, and so even when we all felt a little overwhelmed with all the things that we had to do to make this come to fruition, I think it shows that we like did a very good job in terms of coordinating projects.
Yeah, I absolutely agree. Y'all did amazing work this semester. And I think that was the last question we had. So if anybody has any other questions that were left unanswered, feel free to put them in the Facebook live chat, and then hopefully we can answer them sometime after this event is over. But I want to thank you all for attending this special important event. And also their research paper and their slides, as well as their executive summary, will be up on our website within the next couple weeks. So keep an eye out for that, and keep up with our social medias. It's all WomenNC. Our Instagram is women.nc. You can find us on Facebook, Twitter, LinkedIn, YouTube, as well as this video will be preserved on our Facebook Live, our website, and on YouTube afterwards. So feel free to refer back to this, share it with friends, family, whoever you think really needs to hear this, because you know, knowledge is power. So the more you know, the better you can make more informed decisions about healthcare choices, everything in that regards. So I want to thank UNC Capstone and UNC Public Policy for this amazing opportunity to work with these students, as well as shout out to all these students for the amazing work again.
Yeah. Thank you so much.
So much.
Thank you. Bye.
Thank you.